Today, the theme of the caregiving chat is don't worry, be healthy. Simple tips that you can take to keep yourself healthy and to keep your elderly parents out of nursing homes. I'm Pamela D. Wilson. My website is PamelaDWilson.com. On there, lots of helpful tips for caregivers and aging adults. Plus, my radio show, The Caring Generation, that airs every Wednesday night. On the subject of don't worry, be healthy, there are health measures that we can notice in ourselves and in our elderly parents that indicate that there are health issues. The elderly frequently become frail with age. This doesn't have to happen. My first question to you is, do you walk every day? And if you do, can you walk a mile in 20 minutes or less? The average healthy person can do that. At about age 55 or 60, that ability changes and we begin to walk slower because of aches and pains, injuries, bad ankles, bad knees, bad hips. But physical activity, 1, we can walk every day. 2, it's absolutely free. And 3, we can do it anywhere, in our house, in a mall, outside. There's no reason not to walk every day. Research says that daily walking is one of the best things that we can all do to be healthy and not worry about our health. The other test that you can do for an elderly parent is called a sit to stand. So right now I'm sitting, I'm in a chair that doesn't have any arms. Can your parents stand up without holding on to anything? Can you stand up from a chair without holding on to anything 20 times in a row? If you can't, you're physically weak. The other thing is, can you stand on one leg, hold your other leg up and balance without tipping over or holding on to anything? Those 3 measures indicate frailty syndrome for older adults. That usually is combined with other things that lead to being placed in a nursing home. So it's physical weakness, it is nutrition. I talk about nutrition all the time, and we can look healthy, but we can be malnutritioned, especially if we're over age 60. Many older adults don't get enough protein, which is exactly why they can't walk a mile, they can't stand up from a chair without holding on to something, and they can't balance on one leg. Anybody over age 50 can fall into this category. The other complicating factor is chronic diseases. If you're listening to all the news right now about the coronavirus, you know that older adults who have health issues are more susceptible to the norovirus, pneumonia, the flu, and other viruses. They're all viruses. If you want to, don't worry, be healthy, exercise, walk, do sit to stand exercises, work on your balance, improve your nutrition. Good morning, Don Weston. How are you today in Michigan? Improve your nutrition and manage your heart health conditions. So heart disease, COPD, which is breathing, diabetes is another concern. Anytime we have these multiple conditions, we are more susceptible to viruses. In this video post, there is a link to an article that I wrote about staying out of nursing homes. And if you heard the news over the weekend, you know nursing homes now have precautions to prevent people from bringing in the norovirus. And these are good precautions. They're precautions that normally are implemented for the norovirus, but now they're being implemented for the coronavirus. And because people normally don't hear about these, people are getting all flustered about it. So it's no visitors. You can certainly pick up the phone and call. You don't have to go walk around the nursing home knocking on windows, wondering if your loved one is in there. Pick up the phone. Nursing homes have phones. You can talk to your loved one. Don't feel like you have absolutely no contact at all. The second is nursing homes are not allowing volunteers to come in, which is a good thing because volunteers could bring viruses. That includes ancillary services like people who come in and trim fingernails, who may do hair, massages, things like that. Those people cannot visit. And the other thing is they are doing screening of residents and staff for respiratory infections, which is a good thing. I know that all of this virus information can be very scary, but if we take care of our health day in and day out, not just when we hear about these viruses, we won't have to worry about any of this. 80% of the people out there who get the virus, you may not even know it. You may be sick for a few days. It's normal cold medicine. It's not rushing to the emergency room to be treated. So my advice, don't worry, be healthy, walk a mile a day, do some exercises, improve your nutrition, take care of yourself, especially if you have health conditions. I'm Pamela D. Wilson. My website is PamelaDWilson.com. Visit it. There is a lot of helpful information. And again, in this video post, click on the link. There's a link to staying out of nursing homes for elderly parents, tips on how to do that. Have a fabulous day today. I'll see you tomorrow in another video.